Hi, class. We are still continuing on the urinary system. So just to review, the kidneys are located to the right and the left of the vertebral column between the areas of T12 and L3. Uh, in the previous video that I showed, I was able to show you that the right kidney lies slightly lower than the left kidney, and that's because of the liver kind of pushing that right kidney down a little bit. We know that the adrenal glands lie on the superior surface of each kidney, which is why it's sometimes called the suprarenal gland. That's because it's above the kidneys. And it is retroperitoneal, right? We know about the peritoneal cavity. We know about the visceral peritoneum and the parietal peritoneum. So behind that retro is where the kidneys are. And it's important to note that it does lie to the left and right of the vertebral column. Just yesterday, I had a patient come to me that thought they were having, a lumbar subluxation or a disc herniation because they were having such intense lower back pain. But from my many years of experience, I've learned that sometimes musculoskeletal pain is musculoskeletal, and sometimes musculoskeletal pain is visceral, meaning it's coming from some organ that's referring it to the lower back. And I did a few orthopedic tests, and it came up that she had signs of a kidney stone. And there's a test called Murphy's punch test where I, your my hand goes on top of the patient near the kidneys, and I actually hit my hand like with a fist over the area of the kidney, and it created a degree of discomfort. It was a Sunday, so everything's closed, but I happened to find a radiologist in the area that could do a quick film for me, and it did pick up a kidney stone that she was passing, and that's why the intense discomfort. Many times it really does mimic like a herniated disc or muscle spasms. The patient swears it's the lower back, when in many instances it could be a urinary tract infection, it could be an ovarian issue, a follicular issue, um, it could be a urinary tract infection, it could even be um, uh, like an irritable bowel type of symptom or diverticulosis or diverticulitis. So just keep that in mind when it comes to your healthcare careers is that, sometimes it's musculoskeletal and sometimes it's actually visceral, but it presents itself and disguises itself as a musculoskeletal problem when it's really visceral. Here's a really neat picture just showing the many layers that we have. So we see here the many layers that we have superficial. Here is the right kidney, and we can see the liver here. Okay, so the liver is on the right side. And here is the kidney, and we can see that we have some renal fascia superficial to it. There's a adipose capsule, which is a fatty capsule, and then there's a renal capsule. And the renal capsule is it's that first layer that is superficial to the kidney. Now, here is the peritoneum. You can see the peritoneum. So the peritoneum does surround a lot of digestive organs. It just doesn't surround the uh, the liver. I'm sorry, it doesn't surround the kidneys or the pancreas. They are both retroperitoneal. They are retroperitoneal. Here's a great term, the renal hilum. I know I mentioned it in my previous video. The renal hilum is that hiatus or that opened region in which the blood vessels can enter and exit through the kidneys. And you can see here's the vertebral body of L2. This is the spinous process, and these are the transverse processes. And here's would be the spinal cord here in the center. And you can see all the musculature that surrounds the vertebrae. And this is why when people have kidney issues, it often refers to the musculature in the lower back. And people think it's a musculoskeletal problem when it's really a kidney problem. So again, we can see the right, this is the posterior view. So we see the right kidney is lower and the left kidney is higher. And that's because we're going to have the liver over here on this side. So it kind of pushes that right kidney down. Again, you can see the renal artery and renal vein. You could see the ureters on both sides. We see the abdominal aorta in red and the inferior vena cava in blue. We see the urinary bladder down below and the urethra. One E in urethra, one urethra, and ureter has two E's, and we have two ureters. This is just a dissection, and I forget whether this comes from the APR, the Anatomy and Physiology Revealed, or whether this is from the atlas that you have access to. But nonetheless, it's just a nice um, dissection that shows some things that we've already discussed, like the inferior vena cava, the abdominal aorta. Here's the left renal artery, the right renal artery, the right renal vein. And what you learned when you did the cardiovascular system was when that abdominal aorta breaks through the diaphragm, that first vessel coming off of it is the celiac trunk or the celiac artery. And that had three branches coming off of it. If you remember, if it was the left gastric artery, it was the splenic artery, and it was the common hepatic artery going to the right side. And then off that common hepatic artery was the right gastric artery. And the right gastric and left gastric completed that circulation for the lesser curvature of the stomach. Right underneath the celiac artery, we remember that the next blood vessel inferior to that was the superior mesenteric. And the superior mesenteric goes to the small intestine, the duodenum, jejunum, and ileum, part of the ascending colon, and about half of the transverse colon. And then the other half of the transverse colon and descending colon was the inferior mesenteric artery. So hopefully we can, we don't forget everything from the cardiovascular system. Hopefully we hold on to some of that. Here is the kidney. This happens to be the left kidney. And we know that because, well, here's the liver, and the liver is on the right side. And we can see a little bit of the gallbladder. So we know that that's the right side. And here's the spleen. The spleen is on the left side. So that's the left kidney. The indented region right here is called the renal hilum. So we can see that here. And this is the entrance for the renal artery and the renal vein and the ureter, the nerve, the lymphatics. Everything comes in there in that hilum. Okay, that region right there. So this green section right here would be the renal hilum. The connective tissue superficial to deep from outside to inside. We have the renal fascia, the adipose capsule, and then the renal capsule. Okay, that's what I showed you in that picture that we were able to see. Again, from superficial to deep, we're kind of looking at it from here, superficial to deep, right? The renal fascia, adipose capsule, renal capsule moving superficial to deep. The renal fascia is going to anchor to other structures. The adipose is going to protect, and it too anchors. And the renal capsule is what is continuous with the ureter. So again, when we look at it from close-up view, we can see a few different things here. Again, you can see the vertebrae. You can see the musculature, like the psoas major, which is a hip flexor. You can see the QL, the quadratus lumborum, that goes from the ribs to the pelvis. Here's your pancreas. Here's the spleen. So now we know we're looking at it from the left side because the spleen is on the left. And here's the fibrous capsule here. Here's some fat, the adipose layer, which is here. And then if we move a little bit further out, we have the renal fascia, which is here. Okay, so this is superficial, that renal fascia. You can see it all throughout here. You start to move in a little bit. There's the renal or perinephritic fat. And they move in a little bit more. That is the fibrous capsule or the renal capsule. Okay, so this green structure right here is the fibrous capsule or renal capsule, but renal capsule is not an option here. So now it's important to understand some of the internal anatomy. So you're going to hear terms like the renal cortex or the renal medulla, and then the renal pyramids and renal columns. So cortex is just like the cortex of the brain, right? Cortex means bark or the bark of a tree. And whenever you hear the word medulla, it means the internal part. Um, just like even a bone has a cortex of bone, and then the medulla is the medullary cavity inside. Cortex is outer, medulla is inner. When you took endocrinology, you did the adrenal gland, and when you did the adrenal gland, that was always kind of looked like a triangle. You would learn it like this, right? You would call this the adrenal cortex because it was the outer part, and the adrenal medulla was the inner part, right? So we're carrying on in with the same line of thinking. So in this cross section of the kidney, and this is a view that you should get used to seeing. It's slicing it down the center, and we're looking at the back half of the kidney. This outer portion here is the adrenal cortex. So all of this, not adrenal, renal, my bad. So this is all renal cortex, but all the way around, all the way. When we go a little bit deeper in it, like this portion here, once we're in here, this is the adrenal, not adrenal, I keep saying adrenal, I'm sorry about this is the renal medulla. So you got the cortex, and once you move in a little deeper is the medullary region or medulla. Okay. Now in the medullary region, let me erase this for a second. Let me see if I can get the eraser here. Okay. In that medullary region, we have these pyramids. Right? They look like pyramids right here. So those are called renal pyramids. Pyramid, pyramid, pyramid. These are all pyramids. Now between the pyramids, we have columns. So let me make this, let's say we make this blue. So between each pyramid, there's going to be renal columns. So you have the pyramids, renal pyramids, which are in the medullary region. Between each and every pyramid is going to be the renal columns. Okay. We can see down here on the bottom, there's the renal medulla. They just labeled it here, going this way. So that's renal medulla. And then these openings here, these are the renal sinuses, these cavities here. So right here, this outer portion is the cortex, right? And if we go a little deeper, it's the medullary part, but they're kind of making the shape here of like pyramids. So those are the renal pyramids. What would be the columns? The columns would be here, here, in between the green in these spaces, those would be the renal columns, okay? All right, here we go. So these are the renal columns. I'll bounce back and forth. So those are the green is the pyramids. Here, the green are the columns. Pyramids, columns, pyramids, columns, pyramids, columns. Now we can look at it here. Again, we can look at it a little bit closer. So here is the renal cortex, this outer portion. Now here you can see the renal medulla really nice. This is an area of the renal medulla. This is part of the area of the renal medulla, but specifically the shape of those are referred to as renal pyramids. And in between each pyramid, we're going to have the renal columns right there. So there's the renal column. We could see it here. Those are the columns. Now, what's really neat here is now we're going to hear this term for the first time, nephron. And the nephron is the functional unit of the kidney. That's where it's going to filter. That's where there's going to be reabsorption, meaning what the body wants to reabsorb back into the circulatory system. And then there is secretion, which is saying, hey, we want to put this back into the filtrate so that the body can excrete it out. So that stuff takes place here in this nephron. And there's millions and millions of nephrons in each kidney. And the nephron is important because there's blood circulation and blood that leads into a nephron that's going to be doing the filtering, and it's designed to pull out the toxins and eventually excrete the filtrate, which will eventually become urine right here into that first dilated yellow part called the minor calyx. And there's a minor calyx at the apex of each pyramid. At the apex of each pyramid is a minor calyx. And then let's say this minor, and this minor calyx, they dump into a larger opening, right? Think of it as three different funnels that lead into a larger dilated area. If there's a minor calyx, is going to lead to a major calyx. And now the major calyxes, you're going to have several of them that are going to dump into a more dilated part called the renal pelvis. And the renal pelvis is going to collect all of that and lead it into the ureter. And the ureter leads into the urinary bladder. So the nephron is really kind of involved in the creation of filtering and cleaning out the blood, pulling out the waste, which will eventually lead into urine. Okay. So the opening, let me go back here, this nephron, the last part of the nephron is called the collecting duct. We see it right here. It's the very last part of the nephron, and it's going to dump right into that apex called the papillary duct. and the papillary duct is the opening into the minor calyx into major calyx, and it goes down this flow. So that papillary duct, or the renal papilla, is kind of like right here, right? Then this is a minor calyx. Let me change my pen to red so we can see a little bit better. So right there is the renal papilla, or the papillary duct, same thing, leading into the minor calyx. Here's a minor, here's a minor, here's a minor. All of these are minor calyxes. And then it leads into this more dilated region called the major calyx. And then the major leads into a more dilated part called the renal pelvis. And then the renal pelvis is what becomes the ureter. So what are the green highlighted areas here? Those are called minor calyx. What is this part here? That's a major calyx. What is this part here? That's the pelvis, or renal pelvis. And then what is this part here? That would be the ureter. And then to review, this outer part is the renal cortex. This inner part is the renal medulla. And then we have pyramids. And between each pyramid is a column, renal columns. Let's see, what else do we have? We have a minor calyx here. The minors lead into a major calyx. These openings are called renal sinuses. We have renal pyramids. That minor calyx is going to lead into this more dilated region here called here's the minor calyx. It leads into the major calyx. The major calyx leads into a more dilated part called the renal pelvis. This is just adipose or fat all around the kidney, so they call it pararenal fat. Down here is the urinary bladder. And then this is one of the ureters. Here's the liver. Here's a spleen. Here's the celiac trunk. Here's the superior mesenteric, inferior mesenteric. Here are the gonadal arteries, either testicular or ovarian, because it's hard to tell which one this is, male or female here. Here's the renal arteries. Here are the common iliac arteries, and of course, abdominal aorta. This right here is the inferior vena cava. So, good overview, good summary again. Renal cortex, outer part. Here's the renal medulla, inner part. This is a renal pyramid. Between each pyramid, this is a renal column. This is a renal column. This is a renal column. Okay, nice and easy to see. Now, if you look at the renal pyramid, and we come right down here, this is where that papillary duct or that papillary region is. This is where you're going to have your nephron. So we're going to have something like this, right? You're going to have a bunch of these loops like this. It's going to come down, and that filtrate is now going to lead into a minor calyx. Okay, so this part here in the blue box to the right, the first one is the minor calyx, the larger one is the major calyx. Then it leads into a renal pelvis right here. The renal pelvis, along with the renal artery, the renal vein, that's going to enter into that hilum or the renal hilum. Remember that little opening right here is the papilla, renal papilla or papillary duct. Here are the renal sinuses. Here's the fibrous capsule on the outside. Here are the renal columns between each pyramid. That's a pretty good overview right there. Okay, what's the highlighted section right here? That's the renal pelvis. If it was here, minor calyx, minor calyx, minor calyx, major calyx, renal pelvis, and then here's the ureter. Okay, good place to take a break.